Hello everyone, welcome to today's session. Before going to the topic, our team thanking you for your support and we need your support throughout. Stay home and stay safe. Today I am here with the contents of Bonesofhead. The skull is a bony structure that supports the face and forms a protective cavity for the brain. It is comprised of many bones formed by intramembranous ossification, which are joined together by sutures, which is known as fibrous joints. The bones of the skull can be divided into two groups, those of the cranium, that is, which can be subdivided, the skullcap known as the Calvarium and the cranial base, and also those of the face. The cranium. The cranium is also known as neurocranium, which is formed by the superior aspect of the skull. It encloses and protects the brain, meninges, and also the cerebral vasculature. Anatomically, the cranium can be subdivided into a roof which is known as the calvarium and a base. Calvarium, which is comprised of the frontal, occipital and two parietal bones, and the cranial base comprised of 6 bones: frontal, sphenoid, ethmoid, occipital, parietal and temporal bones. The face. The facial skeleton, which is also known as viscerocranium, which supports the soft tissue of the face. In essence, they determine our facial appearance. It consists of 14 individual bones. The facial bones include 2 zygomatic bones, forms the cheekbones of the face and articulates with the frontal, sphenoid, temporal and maxilla bones. Next one is 2 lacrimal bones, the smallest bones of the face. Then 2 nasal bones, 2 slender bones located at the bridge of the nose. The inferior nasal concave 2, that is located within the nasal cavity. These bones helps to increase the surface area of the nasal cavity. Then 2 palatine bones situated at the rear of oral cavity. Then 2 maxilla, which comprises part of the upper jaw and hard palate. Then vomer, which forms the posterior aspect of the nasal septum. Then mandible, that is the jawbone, articulates with the base of the cranium at the temporomandibular joint. The major fontanelles and sutures of the skull. Sutures are of clinical importance as they can be points of potential weakness in both childhood and adulthood. The main sutures in adulthood are coronal suture, sagittal suture and lambdoid suture. In case of neonates, the incompletely fused suture joints gives rise to the membranous gaps between the bones, and these are known as the fontanelles. The 2 major fontanelles are the frontal fontanelle and occipital fontanelle. Clinical relevance. The cranial fractures. There are certain areas of the skull that are natural points of weakness, like the chirion. A H-shaped junction, a fracture here can lacerate the middle meningeal artery, that is anterior branch, resulting in an extradural hematoma. Types of fractures. There are 4 major types of cranial fractures, like depressed, that is the fracture of the bone with depression of the bone inwards. They occur as a result of a direct blow, causing skull indentation with possible underlying brain injury. The second one is linear fracture, a simple break in the bone, which is transversing its full thickness. They have radiating, that is stellate, fracture lines away from the point of impact. The most common type of cranial fracture is the linear fracture. And the third one is basal skull fracture, which affects the base of the skull. They characteristically present with bruising behind the ears, which is known as the battle sign, that is mastoid ecchymosis, or bruising around the eyes, which is known as the raccoon's eyes. And the last one is diastatic, the fracture that occurs along a suture line which causing a widening of the suture. They are most often seen in case of children. And about facial fractures, the maxillofacial fracture, it is one that affects the maxillae bones. This requires a trauma with a large amount of force. And today, there is a question for you. What's the major signs and symptoms of the skull fracture? If you know the clinical signs, comment on the comment bar. Thank you. Have a nice day.